As the evidence mounts linking ultra-processed foods, UPFs, to obesity, metabolic disorders, disrupted appetite regulation, and even neurobehavioral changes in children and adolescents, policy experts are increasingly calling for regulatory interventions to protect youth health. One of the most prominent proposals under consideration worldwide is the implementation of warning labels on UPFs, explicit, visible alerts on packaging that inform consumers, particularly young people and their caregivers, about the potential health risks associated with frequent consumption. These initiatives are not merely symbolic, they reflect growing concern that the current food environment, saturated with highly engineered, hyper-palatable products, actively undermines public health and leaves young people vulnerable to lifelong dietary harm. Regulatory proposals for UPF warning labels draw inspiration from successful models used in tobacco control and, more recently, front-of-package labeling for high sugar, sodium, and saturated fat content. Experts argue that by providing clear, standardized warnings, governments can counteract aggressive marketing practices, help consumers make informed decisions, and create social norms that discourage overconsumption. Proposals vary in design, from bold, black and white symbols denoting high sugar or fat content, to color-coded traffic light systems indicating relative nutritional risk, but the underlying principle is the same. Give consumers simple, unmistakable information that makes the potential consequences of consuming these products salient and unavoidable. Global comparisons illustrate the potential and challenges of such policies. Chile was an early adopter of front-of-package warning labels, combined with restrictions on marketing to children and limitations on sales in schools. Early evaluations indicate that these measures have contributed to reduced purchases of sugar-sweetened beverages and certain high-calorie snacks, shifts in industry product formulation, and increased awareness among parents and children about the nutritional content of packaged foods. Mexico and Peru have implemented similar labeling strategies, and several European countries are exploring unified schemes to help adolescents and families navigate increasingly complex food environments. These international examples demonstrate that warning labels can have meaningful impact, but their effectiveness depends on enforcement, public education, and complementary policies that address availability, pricing, and marketing. Policy experts warn that without intervention, the consequences of high UPF consumption will continue to escalate. Adolescents exposed to hyperpalatable foods are not merely developing transient habits, they are at risk of permanent shifts in taste preference, appetite regulation, and metabolic function. Continuous exposure to sugar dash, fat dash, and salt-rich foods can blunt satiety signaling, heighten reward-driven eating, and condition the brain for preference toward energy-dense, nutrient-poor options. Left unchecked, this contributes to rising rates of obesity, insulin resistance, type 2 diabetes, cardiovascular risk, and even mood and behavioral disorders linked to poor diet quality. Warning labels are seen as a critical lever to interrupt this cycle by making risk information transparent and accessible. Critics of labeling policies often argue that they infringe on personal choice or that adolescents will ignore warnings. Policy experts counter that current marketing and environmental structures already undermine autonomy. Hyperpalatable foods are engineered to bypass normal appetite control, aggressively advertised through social media and influencer culture, and made omnipresent in schools, convenience stores, and online platforms. In this context, warning labels are not coercive. They are an essential corrective tool to counteract a system that actively encourages overconsumption and exploitation of developmental vulnerabilities. Furthermore, labels serve an educational function, providing repeated visual cues that can shift perceptions of what is normal or desirable, thereby helping to reshape cultural norms around food consumption. Public health implications extend beyond individual behavior. By influencing purchasing patterns, consumption habits, and industry formulation practices, warning labels could reduce the prevalence of diet-related chronic diseases, alleviate healthcare burdens, and slow the trajectory of obesity in youth populations. They could also help reduce disparities. Low-income adolescents are disproportionately exposed to UPFs due to affordability, accessibility, and marketing targeting, and clear labeling provides a low-cost intervention that can inform healthier decisions across socioeconomic groups. The broader societal benefit is potentially enormous, particularly if labeling is paired with school-based nutrition programs, restrictions on marketing to minors, and incentives for healthier food production. The warning for inaction is stark. Adolescents are living in an environment where engineered, energy-dense, and hyperpalatable foods dominate daily life, shaping taste preferences, hormonal appetite regulation, and reward pathways in ways that are difficult to reverse. Without structural interventions like warning labels, education, and marketing restrictions, these trends will likely continue, embedding lifelong patterns of overconsumption and increasing the prevalence of metabolic disease, obesity, and diet-related mental health issues. Experts emphasize that the public health cost of ignoring the engineered risks of UPFs is already manifesting and will only escalate if the food environment remains unregulated. In short, warning labels on ultra-processed foods are more than a policy experiment. They represent a critical opportunity to intervene in the cascading biological, behavioral, and societal consequences of UPF exposure. By providing clear, standardized, and enforceable information, governments can equip adolescents and their families with the knowledge needed to resist engineered overconsumption, support healthier neural and metabolic development, and prevent a generation from becoming locked into lifelong patterns of dietary harm. The urgency is clear. Without decisive action, the engineered allure of UPFs will continue to undermine youth health on a global scale, producing consequences that extend far beyond calories or taste.